Hello, I'm Norbert Gleicher, MD. I'm the Medical Director and Chief Scientist at the Center for Human Reproduction here in New York City. Our topic today is egg freezing. Egg freezing means exactly what the word says. We can retrieve mature eggs from a woman. That obviously requires, if we want to get more than the one egg a woman usually produces in any given month, it requires the use of fertility drugs, which multiplies the number of eggs that we can get in a cycle. And when the time is ripe, we put the young woman to sleep. It's not a general anesthetic, it's just a sedative. The whole process takes maybe 10 minutes. And through her vagina, while she's asleep, with a long needle, we are extracting the eggs. We are aspirating the eggs out of her ovaries. It's basically the same process that is being done hundreds of thousands of times every year in standard IVF cycles. It's exactly the same kind of egg retrieval. The only difference is that instead of immediately fertilizing the eggs, as we do in a regular IVF cycle with sperm, we keep the eggs and freeze the eggs rather than freeze embryos. And egg freezing has become a very popular issue among younger women. And there's a good reason for that, because knowing that you have frozen eggs does not provide a guarantee that you can take it easy as you get older, that you always have something in reserve. No guarantee, but it certainly offers a certain level of security of having at least a backup or a likely backup, and I think that is very important to understand. Nobody can guarantee that the eggs you're freezing, once they are thawed out, will still be alive. Nobody can guarantee that they will be good eggs that will fertilize normally and will give us good embryos. And I can not tell you how sad it is when you sometimes thaw out eggs that were frozen years ago and discover that only very few, and sometimes none of them, survive. But the younger you are when you freeze your eggs, and the better your ovaries work at that time, the greater is the chance that those eggs will work very well once they are thawed out. And if you freeze your eggs, let's say at age 25, and you decide to use them for whatever reasons later, let's say at age 38, you suddenly will not have the pregnancy chance of a 38-year-old with use of your 25-year-old eggs, but you will still have the pregnancy chance, or at least close to it, of a 25-year-old. And that is the great idea behind the concept of egg freezing. Does that mean every 25-year-old should run to see a CHA and have her eggs frozen? The answer is absolutely not. But there is a condition that is called premature ovarian aging. Some people also call it occult primary ovarian insufficiency. And in that condition, women lose their eggs quicker than they should, or sometimes are born with fewer eggs than they should have had. And therefore, they have fewer eggs left at any age than roughly 90% of women of their age. In other words, 10% of all women are affected by this condition of premature ovarian aging or occult primary ovarian insufficiency. Why is that important? First of all, because 10% is a big number. And this number applies to women of all ethnic backgrounds and of all races. In all groups, wherever you live in the world, you have a roughly 10% chance that you are one of those women who prematurely age their ovaries, and therefore at any point have fewer eggs left than the other 90% of women. And this diagnosis 50 years ago really didn't exist. It didn't exist because 50 years ago women had their children so much earlier, and usually they become infertile only at a mid-age, around 35, when their egg numbers drop below a certain minimum threshold. And in some women that can be earlier, in some women it can be later. But the point is important that these women in young years, or in younger years, are perfectly fertile. And so 50 years ago, when there was no birth control or no good birth control, and women had their children early, if by age 35 they no longer felt pregnant, they usually were pretty happy about the fact because they had more than enough children already at home. But today things are different. Today, many, if not most women, at least in the developed world, only start thinking about having children at age 35. Moreover, they have been on birth control, hormonal birth control, for 10 years, 20 years sometimes, uninterrupted. And though premature ovarian aging is a quiet condition, there are very few symptoms, even the few symptoms that sometimes may occur, like suddenly having more irregular periods, even that is covered up by taking hormonal contraceptives. And so what happens to these women is that at age 35 or 37, whenever it is, and they decide to come off the birth control pills because it's time to have a baby finally, suddenly they discover that they can't get pregnant. And it is obviously not only a psychological shock to find out, as a perfectly healthy woman, that you have a fertility problem, it is also a practical problem. Because very often, I would say in most cases, they need IVF. And IVF is not inexpensive, and I'm not even talking about the effort that it requires and the disappointments that come with it at times. It is not necessarily a pleasurable thing to have to go through IVF. And they're the lucky ones, because some of those women, by the time they find out that they suffer from premature ovarian aging, may be so far progressed that even IVF is not going to help them anymore and may need donor eggs. But we have now ways of predicting who is at an increased risk for developing premature ovarian aging. And this is really one of the main messages I'm trying to convey here today. We are not telling everybody, come to see a chart to freeze your eggs. By no means. But we do encourage young women, when you are 23, 25, that you either come to us or you see another fertility center, to make sure that you are not amongst those 10% who will develop POA. Can you make always sure? No. Nothing happens always in medicine. But based on your history, your family history, and just a few tests, blood tests, we can quite reliably assess risk. And we can tell a young woman, you probably have nothing to worry about. You should really watch out, and you really need to be watched every year or every 2 years. Or we sometimes even find at those young ages already women who can be diagnosed with premature ovarian aging. And therefore our message regarding egg freezing is that it is a wonderful way to have some backup that will make you feel better, and if necessary will give you at least a significant chance that you otherwise would not have at more advanced stages. But again, it doesn't mean that everybody needs it. But the 10% who will develop premature ovarian aging, they do need it, unless you know that you are at that risk, and that gives you a second option. And the second option is that you have your babies earlier. Remember, at young ages, even those patients usually can get pregnant spontaneously. So we think that checking your fertility is very important, and it is especially important if you're planning on going on hormonal contraceptives, because, as I said, they often will hide even the few and mild symptoms that premature ovarian aging may present with. Moreover, by being on birth control pills, if we know that you're potentially at risk, we can take you off those pills or your other hormonal contraceptives every year or every 2 years for a month or two, so that we can test you. And then you can go back on the birth control pills if you so decide, if nothing shows. So testing for everybody